Hi there, I'm Dr. Chung and welcome to your friendly proctologist. Thank you so much for joining me today. I really appreciate you listening to me and I hope that this information benefits you. Today I want to try a little bit of a different topic and it's something that I wanted to share with you all, which is about cough medicine. I was shopping for some medicine for my family this past weekend and I thought, you know what? I think people might actually want to hear about this. Maybe they can benefit from the way I choose cough medicine. And for something that seems so trivial, I think that, well, let's just see. Let me know in the comments what you think about it. You know, it's kind of like cough medicine hacks, right? And so let's get into it. I've got my computer set up so that we can look at things together on the internet because in my opinion, what's most important is the ingredients. Yeah, what is included in each medicine? How is it going to help me? Because I don't want to take extra stuff or on the opposite side, I want to take the medication that has the right ingredients in it so I can make sure I'm doing the best I can to feel better, right? All right, so let's get to the computer screen. So we're going to bring this up here and here we go. So I've done a little bit of pre-searching beforehand because I want this video to be a little bit more organized and I want to look at Robitussin's products. It's my go-to brand because it's so widely available and I'm kind of used to it so I know what to expect. And then the ingredients are very clearly labeled and I find it to have also a pretty wide range of products as well so that we can have this discussion about what's going to be good for me, right? Okay, here we go. So if we search Robitussin here, we got the first entry and we're going to get to the home page at Robitussin. I don't want to know what other people think. I want to know what Robitussin has to say. So we go into the home page and we see that adult Robitussin is where we want to go because I want to focus on the grown-ups. Okay? So I want to select all products so we can see what they have to offer. And it's super interesting here that the company has the symptoms. You can also kind of sort by what symptoms you're having and then it lists what is recommended for you. I think that's a very handy feature. It kind of eliminates some of that confusion. But today, you're going to have my help. So look out, Robitussin. Here we go. Okay, so the products that I have selected here are going to be about 4 or 5 of them. And we're going to kind of go, they look like they're in random order, and it's because they're not really organized when you select all products. But here we go. The first one I want to talk to you about is this one here, Cough and Chest Congestion DM. Okay, so let's click on that and let's see what's inside it. Look at that, it's got a better tasting raspberry formula. Oh, Robitussin, you're the best. So here we got product labeling. Oh, and by the way, this video is not sponsored by Robitussin or any cough medicine manufacturer, I should add, okay? This is my personal hack, okay? All right, so let's blow this up here because I want to make sure you can see here. So blow that up by 200% and we can see that I hope that's big enough. Maybe I'll make it 300 so you can see. Yeah, that's about right. So let's blow that up here. Perfect. 300 is the magic number. Okay. So we see that active ingredients is the most important thing here. What's the medications included? And in cough and chest congestion formula has 2 things, dextromethorphan and guaifenesin. What are those? Well, it says here dextromethorphan is a cough suppressant, okay? And this is more central acting, supposedly. It acts on the brain pathways. And then guaifenesin actually loosens up the secretions in your lungs because the because if you have a respiratory infection in your lungs, the cells sense the inflammation and start to produce more mucus and liquid, okay? And that is what you're coughing up, okay? Not just your boogers, but it is what your lungs are making. And so those secretions are super thick, and when they're really thick, they're tough to cough up, right? You feel like you gotta hack your lungs out to get a little glob of goop up. But if you can break it up somehow, make it nice and loose, thinner, then it's easier to get up and you feel better, right? So you can see here that these are the only two ingredients that this formula has. Because, well, you're just trying to address the cough, which is the cough suppressant. Try not to hack away as much. And then you're also wanting the chest congestion, which is loosening up the secretions, okay? And so if those are the only two things, like it's just the chest thing, then yeah, this is the one for you. Why take more than you need, right? Perfect. So let's go on to the next medication here, okay? And if we go back, we will look at another one. Severe cough and sore throat, okay? Let's take a look, and you could probably guess one of the ingredients that's going to be in here, right? I'm going to put 300% here. Perfect. So, all right. So, severe cough plus sore throat, what do we have? We have just two ingredients again, right? We've got dextromethorphan, which we saw on the previous one, which is a cough suppressant. Again, it's try to suppress that reflex to cough, okay? And then we have acetaminophen. That's regular Tylenol. Can you believe that the other ingredient is just as cheap as getting a pill over the counter? I mean, Tylenol is so cheap you can get it everywhere, but I wonder how much this stuff would cost if you left the Tylenol out, because really, you're not doing anybody any favors by adding Tylenol in the syrup. You can just take a Tylenol pill. But anyway, you've got pain relief from Tylenol, you've got inflammation relief, fever relief with this, and so that's why the sore throat with the pain from the irritation back there, that's why the Tylenol's there. And then, of course, suppressing your cough. So if that's your situation, Robitussin is recommending this for you, right? All right, let's keep going here because I want to show you more. Sorry, I'm kind of flipping through here. Yeah, these two are the windows I want to keep. There's another formulation I want you to see, and that is severe multi-symptom cough, cold, and flu. Okay, what's multi-symptom mean? Well, I'm sure if we go back up here, it probably means everything here. I'm not sure. Okay, multi-symptom, you know, I guess more than just cough, sore throat, and fever. Who knows? But if we look at this and we look at the ingredients inside here, what do we find? So let's blow this up again. 300%. Here we go. And wow, you're already seeing it. There are 4 ingredients with this cough medicine. A lot of overlap with the other syrups I just talked about. You have acetaminophen or Tylenol, right? Paracetamol in the UK people. You've got dextromethorphan. Again, cough suppressant, try to suppress that reflex. You have guaifenesin, thinning out of your mucus secretions in your lungs. And what's this new one? Phenylephrine hydrochloride. This one works to constrict your blood vessels, okay? And it's labeled here as a nasal decongestant, but in the way this works is that when you have inflammation, like in your nose where you get all clogged up, or in your face, those blood vessels are enlarged. They're getting wider because they're bringing more blood in. There's a lot more infection to be fought. Cells, the immune system needs those nutrients and the constant supplies to fight. So the that's how our body will normally function to battle a cold sickness. But we don't want all that inflammation and swelling and not being able to breathe through our nose when we're sick, right? We turn into mouth breathers. And that's what this phenylephrine is about, it's really to make the opposite effect occur in our body so that we can constrict those blood vessels and then open up our nasal passages, open up our sinuses. And that's what this is doing here. And so, but here is something that you may need to be aware of, is that phenylephrine it's a generalized medication. It means it goes throughout your entire body, okay? This can effectively increase your heart rate, okay? It is like adrenaline, essentially. And so you need to make sure with your doctor that this kind of medication is safe for you. Now, the amount that they give you is very small, you know, which over-the-counter medication, it should be very safe for the average person, but make sure with your doctor that this is something that's okay with given your condition. The other thing is, we talked about the Tylenol, but look how much Tylenol there is in just 20 milliliters. If you're talking about a cup, that plastic cup that they give you, it's a super teeny amount. And 650 milligrams is like an extra strength Tylenol tablet. So if you're just chugging this stuff, not paying attention to how much you're actually putting in your body, and if you get more than 4,000 milligrams, which is what a normal healthy body would tolerate, you can actually put your liver into shock and actually die from this stuff or get really sick. So it's extremely important that you pay attention to the dosage of these medications and what's in it. You don't want to have some kind of mistake happen like that. Excuse me, phone call. But we're going to keep going with the video here. So what's the hack here, Dr. Chung? You know, what's the best way of doing this? Well, in my opinion, when you look at these 3 formulations here and you see the amount of overlap, okay? And given if your family member is very healthy and they can tolerate these medications being in there, and the medications all, you know, they're priced the same, they're the same cost, I'm gonna go for the severe multi-symptom. I get everything. I get the fever reduction, pain relief. I've got the dextromethorphan for the cough suppression. I've got guaifenesin for the mucus secretions, right? And I've got the sinus relief. Hello, why would I pick anything else? I've got everything here. And so when I go to the store for cold season, I'm looking at all of the ingredients. So I make sure I choose the right one, okay? And so I hope this video has helped you. Make sure to follow the directions on the bottle of these bottles. And again, make sure that you are healthy enough to take these medications as well. If you have any questions, definitely contact your doctor. Again, I wish you well this season, and I'll see you on the next one. Take care. Bye-bye.